Alright, go ahead.
I, Cameron Henniger, voluntarily give Maryville University permission to record my image and or voice and grant Maryville University all rights to use this recording in any medium for educational or other purposes that support the mission of the university. I understand that the following information will be gathered by a Maryville University student as part of a course assignment. I give my express consent for this information gathered in physical assessment to be filmed and posted in the student's course shelf for access by faculty, staff, faculty, and students at Maryville University. I further acknowledge that since the recording is for educational purposes only and the information is not meant to be diagnostic, therefore Maryville University, the faculty, staff, and students are not considered liable. The recording will be deleted by the student and any other devices as soon as it's reviewed and graded by the instructor.
Good evening, my name is Kelvin. I am a student nurse practitioner doing my head to toe assessment for advanced health assessment. My patient today is my son Cameron. Cameron is 23 years old. I would start off by doing inspecting head and face. Head appears symmetrical, normal cephalic, face symmetrical as well. Don't notice any lesions. It's appropriate moisture, doesn't look too dry or too wet. Palpating his head. I don't feel any masses, lumps, or bumps. Any tenderness, Cameron?
No.
Okay, good. And he's got full distribution of hair. Very, very thick hair. Moving on, palpating his eyebrows. Inspecting them, I don't notice any asymmetry. They're full. And like I said, they're symmetrical. No hair loss noted in his brows, and I don't palpate any masses, lumps, or bumps. Eyelids, same. I don't notice eyelashes are full. Appropriate distribution, and notice no drainage. Sclera is white. Pupils and lens are clear, as well as the sclera. Pupils are approximately 2 millimeters in size. Checking his conjunctiva, it is pink, and again, no drainage. Palpating, I feel no lumps or bumps in his eyes. Feel a lacrimal apparatus, and that feels appropriate. So I would next do assess cranial nerve number 2, which is the optic nerve, by just using the modified Snelling chart. So I would be about 6 feet away and have Cameron cover his eye and read the lowest line he can read. Cover.
Oh, right. OLCF.
And switch.
OLCF.
And that is perfect. That is 20/20, which means that Cameron sees at 20 feet what the average person sees at 20 feet. Next, I will check pupillary accommodation. Just follow my pen light in, please, Cameron. Okay, and pupils respond as I would expect. And now I'm going to check direct and indirect pupillary response. Just look at me, Cameron. Okay, and then I note indirect and direct response from his pupils. Next, I will check the confrontation test. Cameron, if you look at me, cover your right eye. When you see my hand, tell me.
See it. See it. See it.
Switch eyes.
See it. See it. See it.
Okay, so these tests check cranial nerves 3, 4, and 6, which are the oculomotor, trochlear, and abducens. With the fields of gaze, I didn't notice any nystagmus or lid leg. So with that being said, I'm going to move on to internal eye exam, looking for the red reflex. I'll start it off with. Okay, red reflex. And I see the vasculature, optic disc, and fovea. Didn't notice any tortuous vessels. Everything looked appropriate. No, bilaterally. Checking for red reflex, and red reflex. And again, I note the optic disc, vasculature, and fovea. It looks appropriate. So the next part of my assessment, I will move to his ears. Both auricles appear symmetrical as far as height. Palpating, I note no fissures. Skin is appropriate. Face and ears, I don't notice any lesions on any of them, and it's appropriately moist. And I will check the internal, the canal. Just inspecting the canal, I see no drainage, no redness. Does not look to be obstructed. I'll check your tympanic membrane. You tilt just a little bit. So I see his tympanic membrane. It is intact. It is pearly gray. I note no arrhythmia. There is some cerumen in the canal. And bilaterally. Again, I note no dryness, no deformities, no lumps or bumps. Any tenderness in your ears, Cameron?
No.
Okay. Now check external canal. I don't see any drainage. No obstruction. So internally. So I see his tympanic membrane there as well. It's intact. Pearly gray, no arrhythmia. And again, on this side, you do see some cerumen as well. So that completes my ears. I'm going to move to the nose. Visually, it's symmetrical. Don't note any obvious lumps or bumps or masses on his nose. So I'm going to palpate, and I'm just going to occlude one and breathe in, please. Okay, and the other one. Okay. So his nares are not occluded, and I don't note, with palpation, I don't note any lumps or bumps or etc. through his nares. I'm going to assess and palpate his maxillary sinuses. Let me know if you have any tenderness.
No.
And then frontal sinuses.
Mm-mm.
Okay. So no tenderness noted with his sinuses, which is a good finding. I'm going to check internal nose, looking at the turbinates and mucous membranes of his nose. Just tilt back for me. So turbinates are pink, and it is moist. No redness noted. And the same with the side. Turbinates are intact. No redness noted, just appropriate mucus. So that completes the nose portion of the exam. Oh, I forgot. Olfactory. Cranial nerve number 1 was olfactory. We'll test that through smell. Just go ahead and occlude your
Vanilla.
and then
Hand sanitizer.
so I'll move on to inspecting mouth. Lips. He does have a history of a cleft lip, so his unrepaired or self-repaired lip is there. Lips are pink. No ulcerations noted. No dryness, so that's appropriate. So they could go ahead and open up, camera. Say ah. Okay. So I note no receding from the gums, no bleeding, no ulcerations, no bumps noted. Stick your tongue out for me. Out. Open up wide. So posterior pharynx is nice and pink. No exudate noted. No swelling noted. And so now I'm going to test cranial. With this test, I can do cranial nerves 9, which is the glossopharyngeal, and 10, which is the vagus nerves. By saying ah, that shows cranial nerve 9. and 10 are intact. I can also do hypoglossal, which is cranial nerve 12, just through his tongue motions. So I'm going to have him go through those now. So if you could stick your tongue out, stick it to the side, to the other side, up and down. Okay, and then cranial nerve 5, which is facial, I can do with, or trigeminal rather, I'm sorry. And then 7 is facial, we'll do through facial expressions. So if you could grimace your teeth, eyebrows up, frown, and that shows that both those cranial nerves are intact. Also, I'll test while I'm here the cranial nerve number 11, which is the accessory nerve, and that's just through shoulder strength and motions. So as I push, give him resistance, push up, and he pushed up, that's good. So I'm going to move on to the neck portion of my assessment. Visually, it is appropriate. No lumps, bumps, or masses are apparent. I'll start with preauricular node, postauricular, tonsillar, submandible, submental, superficial cervical, posterior cervical, occipital, and supraclavicular. And with those, I didn't note any node differences or swelling. Assessing his trachea is midline. Thyroid is appropriate. I don't feel any lumps or masses on it. And swallow. And swallow, that also is cranial nerve number 9. Shows that cranial nerve number 9 is intact. So that completes the head portion of my assessment. So if you could, Cameron, please take off your shirt. So for this portion, I am moving into respiratory. I am inspecting him just by him being here. I see a regular rate and rhythm. He's not using any accessory muscles in his work of breathing. It remains nice and calm and relaxed in his effort. I'll start by palpating, looking for any crepitus or thrills or rubs or etc. Go ahead and say 99.
99.
Okay, I don't feel any excessive fremitus. Palpating his back, say 99.
99.
Okay, and then while we're here, we'll do diaphragmatic excursion. Go ahead and take a big deep breath. Good. And then also, since I'm back here, let's do CVA tenderness. Just let me know if it hurts.
No.
Okay, good. So there's no CVA tenderness, which if you did have, it would be indicative of kidney infections. So I'll go ahead and percuss his lung fields. I anticipate hearing resonance, which is a normal finding. Hyperresonance could be indicative of consolidation or underlying pathology. So all I hear throughout his lung fields so far is resonance. And looping him back. Okay, good. Listening, I'll start off on the front. Just relax. So listening, I'm listening for his rate, listening for any excessive breath sounds, which I'm not hearing. Take a deep breath. Take a deep breath. Okay, and throughout auscultation, I didn't hear any extra breath sounds or adventitious breath sounds. So that completes the respiratory portion of the assessment. If you could, please take a seat on the bed, Cameron. There, we'll do heart. Lay down. So moving on to the heart, just inspecting again as well. Don't see any striations, no obvious pulsations or thrills or anything like that that I can visually assess. I don't see any jugular venous dissension, which is a normal finding. Palpating. In palpation, I don't feel any thrills or rubs. I'm going to palpate the carotid. Okay, I don't feel any on that side either. So listening. So with the diaphragm, the aortic, I'll start off at aortic space. It's second intercostal space, right sternal border. The pulmonic is second intercostal space, left sternal border. Erb's point, left border, third intercostal space. And then lastly, mitral, which is midclavicular, fifth intercostal space. Now I'll switch to diaphragm and do the same. So pulmonic. And so far I'm not hearing any, it's just a regular rate and rhythm, and this is, or excuse me, that was aortic, this is pulmonic. Tricuspid, third intercostal space left, and then lastly the mitral. We'll listen to his carotid for any thrills or bruits, which I don't hear any. And then palpating the PMI, I don't feel any there. So if you could, come to your left side, Cameron. I'm going to listen for mitral valve stenosis. Okay, I hear no stenosis. If you could come just sit forward. Yeah, maybe. And come forward a little bit and take, lean forward. There you go. Exhale all your breath. And I'm just listening for aortic regurgitation, which I don't hear anything. Okay, go ahead. So that, I will check his brachial pulses. While I'm here, checking axillary nodes, which I don't assess any, and epitrochlear, and radials. They're all about +2 as far as depth and pulsations. Moving on to abdomen, I would start with abdomen. You always start with inspection, as with everything. Actually, you start with inspection. No obvious masses noted. Again, no pulsations. He looks symmetrical. His AP diameter is appropriate. And now I'll go ahead and assess and listen to all of his fields. Expect just low gurgling, about every 5 to 35 seconds or so, or per minute, I should say. So these are appropriate sounds, just nice gurgles. They're about every 10 seconds or so. Assessing or auscultating aorta, iliac, bilateral iliac, the renal, and then femoral. Okay, so I didn't hear any, or I forgot liver and spleen. I listened to those. With liver, don't hear any rubs, or with the spleen. So next, I'll percuss his abdomen, expecting to hear tympany because it's over gas-filled organs. Okay, and that's appropriate. Check liver size. Here's the bottom edge. So it's about 8 centimeters, so which is normal for its size. And also, I will try to assess for spleen. Okay, I don't hear any spleen, which is, if I did hear it would be indicative of splenomegaly. I'm going to start off by palpating, just doing light palpation at first, looking for any superficial masses or tenderness. Let me know if you feel anything there. Okay. So he's not showing any tenderness. I'm not feeling anything out of the ordinary. So I'm going to move to a little bit deeper palpation with this, just looking for any deep masses or tenderness. An attempt to assess right kidney. There's the liver. I can't assess spleen, which is a normal finding. And check inguinal nodes, and if it's being addressed, it's hard to feel the femorals, but I would check his femorals as well. Okay, so I think that completes my abdominal portion of my assessment. I'm going to move on to musculoskeletal. If you could stand up, please. We start off with just check the temporal mandibular joint, just looking for any crepitus, range of motion. So if you could open your mouth, nice and close it, move your jaw back and forward. Any pain, tenderness?
No.
And I didn't note any crepitus or whatnot with palpation. Moving on to the neck. So if you could, Cameron, would you please just look down to the ground? Okay, look up to the ceiling. Good. Left shoulder, ear to left shoulder. Oh, ear to right shoulder. Good, and that's just all indicative of good range of motion for his neck. Moving on to his shoulders. They appear symmetrical. No redness, no arrhythmia, no swelling noted. Any tenderness?
No.
Okay. So I'm going to have him do extension. So if you go arms up. Good. That was flexion, right? I'm sorry. Adduction is this way. Okay, good. Adduction is across. Okay, and then extension back. Okay, good range of motion there. And then we're going to do internal rotation, just like you're covering your, brushing your hair. And then both sides, please. And then external rotation behind your back. And he's got good range of motion throughout those. So next, I will have you take a walk. When we go for our walk, just walk normally, but then when you come back, do heel to toe. We'll knock two out at once. Just go up that way, Cameron. Okay, good. And he had good gait. Didn't notice any wobbling. He did well. So I will continue with musculoskeletal, and I will assess his spinous process. I feel S1, or excuse me, S7 and L1. They are appropriate. Go ahead and bend forward all the way and touch your toes. Good range of motion. Don't note any curvature in his spine. Okay, and then flex back. Okay, good. He's got good range of motion with and twist and twist. He's got good spine range of motion. So for elbows, I want you to flex like you're doing a biceps curl. Good. And now come down like this. Now let's pronate. And he's got good pronation and supination. So I want you to hands down, hands up. Good. Fingers down too. Okay, good. Now I want you to resist. I'm going to push down on you. I want you to resist. Good bilateral strength. I'm gonna push up and you resist, and equal strength there as well, like this. Okay, I'm gonna pull on you, resist. Okay, you had good strength. I'm gonna push. Good strength bilaterally throughout there. So go ahead and put your palms down, splay your fingers out, and that is good. Resist me pushing them in. Okay, good. Now I want you to squeeze my two fingers as hard as you can. Okay, he's got good, good bilateral strength. So that completes the upper body portion of the musculoskeletal. So if you could go ahead and lie down here. So I'm gonna push down against your knees. Resist me. Good. Now resist me. Good. Go ahead and pull your knees up to your chest. Good. Go ahead and take this leg away from midline and bring it back. Now this one. Good. So I want you to do the same thing, but against resistance. Good. Now try to put them together. Okay, perfect. And so I want to test your range of motion. So I want you to put this foot right here. And good, you got good range of motion in that hip. Now we're gonna go this way. Good. And now same for this side. Good. Good. Now feet, go ahead and gas pedal. And bring them back. Good. Now back against resistance. Good, nice and strong. And nice and strong. And while I'm here, I'm noting that his legs are appropriate temperature. Hair is well distributed. Don't notice any lesions, etc. on his legs. So if you could come to the front, or the foot of the bed, Cameron. So I want you to swing your lower legs out. Okay, good, good. Now I want you to do the same with your feet, just your feet. And out, good. So I want you to take your heel and put it on your opposite and then take it up to your knee. Okay, good. Now the other side. Good. And then I want to do rapid repeated motion. So I want you to just, and then slowly get a little bit faster. Good. He manages it that well. So I'm going to check for proprioception, just to kind of see if he knows where his body is in space. So I'm going to use one of your toes, Cameron, and tell me if it is where it's going.
Down.
Okay.
Up. Down.
Oh, this one.
Down. Up.
Good. And then so I'll check his reflexes, or actually I can do vibration as well. So just for sensation, tell me when you feel the vibration, or if you do. Yep. 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 And lastly, I'm going to check his reflexes. So I'm going to check triceps, brachial, radial, I'm noticing nice movements. Biceps, radial. Good. And check patella. And he has good kicks out with those. And lastly, the Achilles. Okay, and that is it. I think that completes my assessment.